You are with the big story here. I'm Seher Zama. Thanks for being with us. A 3-week lockdown that has been announced by the Prime Minister here, making it very clear that we need to respect this. This is the only situation available here to break the circuit of the coronavirus. This is an extreme measure, but despite it being extreme, there are facilities being provided here to us. This is in terms of essential services which will continue to remain available to us, certain terms and conditions on who all are allowed to step out in this lockdown as well. But it's important that we remain indoors, we remain in our homes, restricted to our space for these 21 days, and also to remind our viewers that we are very responsibly doing the same here on Mirror Now as well. Each one of us having set up our mini studios from our house, from our living rooms, and yet continuing to bring out the news to you. Let's get you further details here. The focus in this show is going to remain the lockdown and the preparedness for the lockdown, not just in terms of the physical preparedness of having essentials available to us, but also the mental preparedness of being indoors into our confined spaces, despite this being our comfort zone, our homes, but the mental stress it can cause and also how we can cope. All of that needs to be discussed and taken into account today as well. From today onwards, this is day 1 of the lockdown. The complete lockdown of 21 days is what we are looking at. Prime Minister Modi, as we all know, made this announcement last evening, emphasizing that this is the only solution available. Also, to remind our viewers that stepping out is now going to be a punishable offense if you're stepping out without any reason. This is going to be a punishable offense, inviting a jail term of 1 year. It is that important to remain indoors, and the police is out on the streets to keep a check on this. If you're stepping out here for no essential reason, you will be sent back home. Let's get in further details. We have with us our team of correspondents here. They're on ground, of course, keeping a safe distance, maintaining all the precautions there, and yet continuing to get us those details for each of our viewers watching us here. We have with us our correspondent Ayushman from Delhi. This is at Mandi House there. Neha Hebale is at the Chinnaswamy Stadium. First to you, Ayushman, Mandi House is usually, of course, a very crowded place with a very heavy footfall, day-to-day activities that continue. All of that, of course, would not be seen right now. But the discipline that we see that needs to be maintained on ground, what is it that you're observing?
Well, sir, rightly pointed out here, what we see on a normal day is completely different to what we are seeing right now. The complete lockdown that is there in the national capital is visible. Clearly, you can see over here, this is the road which leads towards the Bengali market. You see that police vehicle which is going inside, that's the road open, and police patrolling is being done. That's the media vehicle which is being allowed. Continuously, the police public announcement is being made that there is a lockdown. You can see the vehicle patrolling that is taking. Those police officials are there. The police has barricaded the entire inner bylanes of the roads which you are seeing. This is one road which leads towards the inside of the Mandi House circle, and that has been closed by the Delhi police. Similarly, this we could find a few of the people who wanted to go to Anand Vihar, and they were forced.
All right, Ayushman, we're going to be reconnecting with you on that in just a bit, please, with that audio connect. But of course, Ayushman, as was pointing out, some people were seen stepping out. The police did intervene at that point. And this is what we're going to be seeing happening across the country as well. Remember, each of the respective state governments have been asked to follow this instruction that has come in from the center to observe this 21-day lockdown. A lot of the states had already called in a 14-day lockdown, but this is now a week extra. It's 21 days. It's 3 weeks, and all the more important that we continue to practice all these precautions that we have been. Our correspondent Neha Hebale with us here as well. This is from Bengaluru at the Chinnaswamy Stadium. Yes, Neha, please go ahead. What can you get us?
Yes, Seher, ideally, at this time of the year, keeping in mind the fact that, if the IPL was going to go on, then, you would see a lot of people actually lining up on these roads around this time, to pick up their tickets, who are coming down, to have inquiries. But today, in the far distance, actually, that's where the stadium is. And as you can see, despite, the lockdown, you're having one or two vehicles that are still coming out. Hopefully, of course, these are only for essentials. As you can see, the police also very strictly standing there reinforcing that people are expected to stay home. Just to remind our viewers and for those who are unaware, coming out today, if it's not an essential, will attract a jail term of almost 1 year. Now, that is a serious offense. It will be considered. Also, of course, as you can see, all the roads, of course, the important roads that would ideally see people coming in on large numbers. This area that we're at, so just to make our viewers understand, you have a lot of important things around this area. You have the Vidhan Sauda, you have the High Court, you have the Cubbon Park. There's a massive HAL office over here. There's MG Road, Brigade Road. It's all just around. This is the central business district. And as you can see, of course, the signals are still functioning. The people who are coming out on the roads are plying with this. But all people who are not to be on the roads today are being sent back. The strict enforcement by the police officials over here at every single junction. But despite that, we're seeing people still coming out, especially at the grocery stores where we were a little while earlier. We showed you how people were in one or two shops, and the smaller ones were maintaining the social distance. But in the larger retail outlets, there was, in fact, a mad rush, if we can call it that. And authorities are time and again, reiterating that there is no need to stock up. There's no need to panic. By people are really urged and requested to stay home, at least for the sake of their loved ones and also for the sake of those in essential services like the media and the medical representatives and the police who are constantly on their job.
Neha, well pointed out there. Administratively, of course, this is going to be handled to the T with each of our respective governments. But stay on with us, please. I'm going to be introducing our experts with us who've been kind enough to join us in the midst of this. With us this afternoon, we have with us Dr. Anand Bhan, researcher at the Global Health, Biotech and Health Policy. Thank you, Dr. Bhan. Also, Dr. Mahesh Gupta, chairperson and the managing director of the Kent RO Systems Limited. Thank you for being with us. First to you, Dr. Anand Bhan, as we've, of course, been discussing administratively on how the government and the police needs to manage this on ground, but at home, when all of us are at our homes to be dealing with this lockdown for 21 days, there are a lot of other issues that need to be taken into account as well, not just the concern of being stocked up, not just the concern of not panicking or having essential services available, but also the mental aspect of this, on how this needs to be dealt with on a day-per-day basis.
Thank you for having me. Yes, absolutely. I think that is extremely important, and especially so now because this is something I don't think any of us has seen before. For almost all of us to be actually sitting indoors for 21 days as is expected is going to put us through a
Yes.
stressful time. There is going to be anxiety. There are going to be mental health concerns. But it's extremely important for all of us to work as a community, so with our family members, with other members of our community, support each other, ensure that there is some kind of a routine. Those, for example, who have to take regular medication should stick to that schedule, ensure that their health is taken care of, ensure that they're healthy, ensure that there is some element of exercise, if possible, that you do, whether on your rooftop, whether indoors, that you continue to maintain, and ensure that you have lines of communication open so that you can reach out to other people if there is an emergency of any kind, so that you are aware of what is happening, and so that you don't get caught off guard. At the same time, it's also important for us to recognize that the key reason for doing this step is a few things. One is that to ensure that there is social distancing, which is being enforced, because we've had some lackadaisical response to that, and that is why you need to ensure that we have steps like this happening. So you want to prevent people who are not infected from getting infection by keeping them indoors. Those who might be potentially infected, again, if they are kept indoors, they will not be going out and spreading infection, especially if they're asymptomatic. And the third element is, hopefully with a ramped up testing strategy, individuals who might be potentially infected could be identified at their homes, traced, isolated, and kept on treatment so that we prevent any further spread of infection. But it will require actually all of us to work together, and as you're
All
rightly
right.
pointing out, to ensure that we all take health.
Absolutely. Please stay with us. Also getting in Dr. Gupta here on this. Dr. Gupta, this is of course also with respect of maintaining extra hygiene while we are indoors, maintaining social distancing even amongst ourselves within family members, keeping that space when we are locked up in our homes.
Yeah, absolutely. I think first and foremost important thing is for everybody at home to understand why this is being done. If we don't have acceptance, then we tend to break it. So we must understand and we must teach each member of the home why this is essential to keep a distance. We have seen in China, we have seen in Korea. Korea is not so much, but China we have seen. Keeping a distance, they have been able to eradicate this disease by and large. So if we don't get in touch with the external people, we will not get this disease. So keeping in home is basically this purpose. So distance means within the house you may not keep the distance, but at least from the outsiders you need to keep a distance because any infection is going to come in from the outsiders. So once we understand the importance of it, at home we need to see day by day. So one day by day, don't look at 21 days. Then you start feeling it's a long distance. So each day has to be looked into one day and see that you enjoy that day and move on to the next day. And I think it's time that we slow
That's
our
right.
life. And it's a time that we need to understand that it's an opportunity given to us to slow our life a little bit, take it as a holiday, and maybe it's a holiday indoor, then you will enjoy it as well. So given the opportunity that you need to stay inside, develop your hobbies, do something
That's right.
so creative.
And there's a word for that. There's a word for that. Staycation, staying at home vacation,
absolutely.
is something
like
that now
word.
we need to look at very seriously for 21 days. So the staycation is perhaps the most positive way to look at it. Of course, there's lot much more work. Fortunately, that's going to keep us occupied at home here as well because a lot of us are working from home and we're doing our household chores as well. We've taken care of our domestic help and sent them away, made sure that they stay at home here as well. So this is going to be a very heavy staycation that we need to observe. It's 21 days, but let's take one day at a time instead of thinking of all the burden of the 21 days here. Please stay on with us. Ayushman, our correspondent in the national capital here at Mandi House, reconnected with us. Ayushman, it's also important that the police be made to understand those who are exempted from this list of staying at home because they are part of emergency and essential services. We have seen very unfortunate incidents of media persons being beaten up or dealt with sternly by the police, medicine delivery boys, food and vegetable delivery boys being sent back and dealt with sternly. It's an important word that needs to trickle down to the police as well, that while this is a strict measure, we need to be very humane about this as well.
Very important, sir, for that because today one of the drug association member also pointed it out that if police continues with the way like it is doing right now, it will cause a disruption in the supply because the people who are responsible for delivering the medicines are also being hassled on the way when they are going for the delivery of the medicine. And that is why he gave a statement and he said that the police need to brief the staff members who are there on ground responsible for checking. Today morning we saw a few of the workers who were responsible for delivering the medicine. They were also told by the police to return back, and in a way the drug association member said that the police needs to take a humane approach in this because it will cause a disruption if this continues. At the same time, there are several healthcare facilities workers as well, including some doctors who have said that they have faced ostracization. That is why yesterday the Union Home Minister wrote a letter, and then we saw an appeal from the Chief Minister as well that people needs to adopt a more humane approach towards these people who are working tirelessly. And also the Delhi police on ground has been briefed that there are essential services which needs to be exempted. But definitely this is the first day, so there will be some kind of miscommunication. But we expect that in coming days, since it's a 21-day lockdown, in coming days things will improve. But for now, definitely, sir, if you see the roundabout at the Mandi House, which is very, very significant and very centrally located. It bears a deserted look. There is a Delhi police canopy there where the police officials are checking the vehicles, and also the inner by-lanes have been barricaded so that none of the people who want to come here to or want to stay here, there is a public announcement system that is there, and they continuously on bike, the Delhi police make sure that nobody stays here and everybody goes inside during this lockdown period.
Yes, it's unbelievable. It's unimaginable to be seeing Monday House like this, but undoubtedly it is for the best cause for each one of us here. Another very crowded place, pulsating with life and activity. One of my favorites there is Churchgate in Mumbai. We have with us our deputy news editor Mayuresh there from Churchgate. Mayuresh, we would hope that a lot of this lockdown is being observed not just with a stern hand, but respected by each as well.
Yes, if you see from the morning, we are observing that the people are really respecting what the state government or the central government has asked them to do. They are completely staying at home. In the morning session, we saw that a lot of people came out, but they came out for to purchase the essential commodities, like whether it's a milk or vegetable, fruits. For that only they came out. But throughout the day, or we can say till afternoon, we saw that people were not roaming on the streets, which we have seen a couple of days back, that people were easily roaming on the streets. So certainly Mumbai police is also making sure that people will not roam on the streets. Even in Mumbai, if we talk about, people have respected. There were queues outside the big supermarkets, but there also people were distancing themselves from the people. They were keeping that sufficient distance, and also you can see that whenever people come on the road, they are wearing the mask and maintaining that hygiene. So yes, Mumbaikas are respecting what the Honorable PM had asked them to do, what Honorable CM had asked them to do.
Please stay with us. Getting in Dr. Bhan now at this point. Dr. Bhan, we were also discussing mental issues that need to be dealt with. And this is, of course, just basic management of stress that needs to be dealt with here as well. But also those who are suffering from issues such as diabetes and dialysis. A word out from them as well on how to deal with this. There is going to be restrictive movement outside. It's going to be under check. It's going to be under balance. But still, the preparedness to deal with this.
Yeah, so that is extremely important. Thanks for raising that point. I think for those who are on any kind of chronic medication, please ensure that you continue taking your medication on time at the correct dosage. It's also a time of stress, and that can impact your health. So please take care of yourself. Make sure if there is any kind of concern that you might be having a medical emergency, that you reach out, use local avenues of transport which are available for emergencies, work with the administration and get to a hospital. But more importantly, it's also to ensure that you have adequate stocks at home. As we have discussed, there might be possible chances that they might be closed facilities, medical stores might not always be open. So when possible, do try to get your adequate stocks. If you can call in and get people to deliver that at home, or you can go and buy that from a hospital using permissions, then that would be a good idea. I think a lot of medical professionals are also now open to being reached out to. So if you have a phone number for your medical doctor or for the hospital where you're consulting from, if there is any concern around anything that you're having, any side effects that you might be seeing, or any symptoms that you're having, then it might be a good idea to get in touch with your doctor or your hospital and try to get some input. Most routine OPDs are closed, but medical professionals are working, and they're happy to help out through any mode of communication. These are special times, and people are willing to help in any way that is possible.
Yes, and it's just not counseling for people sitting at home. It's counseling for people who are out there continuously, literally battling this out here as well. Dr. Gupta, there needs to be a strong word that needs to be sent out. In your view, this is with respect to counseling for our police personnel, counseling for our medical practitioners and doctors who are dealing with this on a daily basis.
Yeah, my salute to them, and we need to applaud the work which they're doing it. They're risking it at their life, at the cost of their lives. And they're maintaining law and order, they're maintaining the essential services, and special attention to them, because the amount of stress we can see in the videos today, On the one side, people are not obeying the rules and they have to take care of them. On the other side, there are genuine people who are suffering because it becomes very difficult for them to differentiate between the genuine and non-genuine. But they're doing their duty. And a special salute to the people working in hospitals. They're in touch with the people who are infected and they're taking care of them. They're taking care of their life at their own cost. So it's a laudable effort, and every member of the society should applaud their work. And words cannot describe what they are doing it.
All right, please stay with us because we're taking in some examples here of cases that have been reported here of police, of course, which has been given very strict instructions, but how this is being dealt with on ground. Is the police overstretched and stressed as well? The police needs counseling as well. Employees of the food aggregators Zomato have now raised concerns for food deliveries, for places where they need to be dropping in their deliveries. It has drastically, of course, come down, which is owing to the lockdown. In a video now, which in fact has gone viral, let's in fact get in a glimpse of this video for you, wherein which we have one of the delivery boys narrating their ordeal here, saying that as delivery executives who used to get 30 rupees per food delivery are now left in the lurch.
जो हमारी कंपनी है उसने हमें काम दे रखा है फूड डिलीवरी का, और आप जानते हैं आज के टाइम में पूरी हिंदुस्तान बंद है, उसके बाद भी हमारा काम स्टार्ट है। जो लोग घर बैठ के पैसा कमा रहे हैं और आज हम घर से निकल कर भी पैसा नहीं कमा पा रहे हैं, उसकी एक बहुत बड़ी वजह है। ठीक है, वही चीज़ हम आपको आगे बताएंगे। हमारे भाई आपको थोड़ा सा बताएंगे कि किस तरह से हम यहाँ पर इकट्ठे हुए और क्या वजह है उसकी, और हम कितना परेशान हैं।
नमस्कार मेरे भाइयों, आपसे एक विनती है कि हमारी जो वीडियो बनाने का एक मोटिव है कि हमारे साथ कोई परेशानी चल रही है। हम लोग जो हम काम करते हैं वीकली सैलरी पे नहीं है, एक ऑर्डर बेस पे काम करते हैं। जिसका ऑर्डर बेस है 30 रुपये पर ऑर्डर, जिसके अंदर हम हमारा पेट्रोल खर्चा भी इसी के अंदर चलता है। बिल्कुल 30 रुपये का ऑर्डर, मतलब हम मर्चेंट से ऑर्डर उठाएंगे और ऑर्डर उठाने के बाद डिलीवरी करने जाएंगे। ठीक है सर, अब हालात ऐसे हो चुके हैं इस कोरोना वायरस को लेते हुए, इस समय यहाँ पर ऑर्डर बेस खत्म हो चुका है। कोई भी बंदा, कोई भी कस्टमर हो, चाहे हम ही क्यों ना हो, हम भी बाहर से खाना पसंद नहीं करेंगे इस समय। यानी कि इस समय जो पहले के मुताबिक, पहले जो ऑर्डर लेवल था बीमारी से पहले इस कोरोना